Ladies and gentlemen, this is an article that came out on Forbes.com November 30th, 2017. America's opioid crisis, a nation hooked. And, this story is very interesting because it really gets into the details of who's having the biggest problem in our nation. And I can't get back to, let me try this. Okay, here we go. In a speech last month, Trump declared America's opioid plague a national public health emergency, telling observers that nobody has seen anything like it. He's right. The opioid plague is being called the worst public health crisis in American history, with its lethal consequences exacting a toll on users, families, and law enforcement nationwide. And that's very true. On that MSNBC documentary, it was saying there's virtually hardly no white people out here that has not been impacted by this drug plague. They either have family members, some of them have 2 and 3 family members that died. Some of them have, friends, or they know someone directly or indirectly that have died from drug addiction. So that, that's very true. Though the affected span all ages, it's boomers who are pushing up overdose rates the most, a divergence from typical demographic patterns and a reflection of a risk-taking ethos that has followed these generations into maturity. In 2015, more than 52,000 Americans died of drug overdoses. Nearly 2/3 were linked to opioids such as OxyContin, Vicodin, heroin, and fentanyl. These figures have quadrupled since 1999 and is now the highest on record, exceeding the death toll of the past heroin epidemic, the crack epidemic of the 1980s, and the peak of the AIDS epidemic in the 1990s. Drug overdose now kill more Americans than car accidents or guns. And the number keeps rising. A preliminary analysis by the New York Times estimate that there were 59,000 to 65,000 such deaths in 2016. It's even possible these numbers are too low. Trust me, they are. Because if they die of an illness on top of drugs being in their system, they usually will put the illness on the death certificate and make no mention of the drugs. And you saw this happen in the case of Carrie Fisher. Because many deaths that result from opioid-induced conditions such as pneumonia aren't being counted as overdoses. So I estimate it's probably double or even triple the 59,000 to 65,000. But you can tell me what you think in the comment section, right? All right, let's move on. This crisis is so significant that it has contributed to worsening population mortality. U.S. life expectancy fell in 2015. And if you remember, I did an article that said, so many people are dying on drugs, it has shortened the life expectancy. That's now dropping. And has seen almost no gain since 2013. To be sure, there were other reasons behind the drop, including increased mortality for leading cause of death like heart disease. But the CDC researchers cite a jump in unintentional injury deaths. These are people that have drugs and alcohol in their system, and then they get into some type of accident and die. Namely, drug and alcohol overdoses as another major contributor. As the number of fatalities has shot up, the public face of addiction has shifted. In contrast to past drug epidemics, opioids are killing white Americans at double to triple the rates of their Black and Hispanic peers. And that's the truth. And you can find multiple articles out on the internet that pretty much says the same thing. The problem is most acute in rural areas, but transcends socioeconomic class and income level. What's more, it's the middle age who've been hit hardest hit, and that's true. And if you notice, the age range also correlates with suicides, and I just found that interesting. And you can tell if that's the case, you can tell a lot of these drugs are psychologically altering them to give them those suicide tendencies. Though overdose death rates have risen for every group, late wave boomers, and these are the people 55 to 64, have seen the most dramatic percentage point spike since 1999. The highest death rate, 30.0, meanwhile, belongs to early wave generationers, and those are the people 45 to 54. And that actually matches the suicide. I just find that correlation really spooky. How the suicide age and the drug overdose age match. Not a coincidence. The geography of the crisis has changed over time as well. In 1999, overdose deaths were largely concentrated in Western states like New Mexico and California. By 2015, they had spread across a more diverse range of states, and the epicenter of the crisis had shifted eastward to the Rust Belt, rural Appalachia, and New England. Many victims come from overwhelmingly white areas in states like Ohio, Rhode Island, West Virginia, Kentucky, and New Hampshire. Leading the nation in per capita overdose deaths is Ohio's Montgomery County, which is on track for 800 fatalities this year, and where the coroner's office routinely runs out of room for bodies. Many commentators link the opioid plague to economic difficulties. And if you remember, that was when they came out with the deaths of despair. That was Ann Case, I believe her name. Yeah, here she is, right here. Princeton economist Ann Case, for example, suggests that struggling Americans are self-medicating to soothe the beast brought on by stress and poor health. Researchers by another Princeton economic is Alan Kruger, found that 44% of prime age, and that's working age male, labor force dropouts, roughly 7 million men, take pain medication on a daily basis. That's a lot of people. Woo, that's a lot of people. In 2/3 of cases, they take prescription drugs. These men report lower levels of emotional well being than their employed counterparts. But this theory is incomplete. Ours is not the only nation experiencing economic trauma, yet, no other country is afflicted by opioid. And that's true. Europe has it, but it's still not as big as America. Canada is probably the next biggest one in North America. And then, the only other one that got one as big as America is Russia. We consume an astonishing 80% of the world's supply and 99 of the hydrocodone supply. Wow. America's hogging it all up, huh? The better explanation points to something uniquely American. The U.S. medical industrial complex, which has facilitated the mass proliferation of prescription painkillers. In the 1990s, doctors faced pressure to treat pain more seriously as the fifth vital sign. They turned to opioids, which pharmaceutical companies were pushing hard. Yeah, and see, back then they were making a claim that they were non-addictive, and as you can see, that was a lie because it was really all about making money as a safe solution. The US healthcare system equates quality of care with the ability of doctors and hospitals to deliver what patients ask for. Wow. So so what it's really saying is all the patient had to do was request the opioids and the doctor just pulled out their script pad and wrote it out. That's all it took. Wow. In 2012, doctors wrote, listen to this, 259 million opioid prescriptions. Damn. My goodness. Enough to give a pill bottle to every adult in the country. 12 states had more prescriptions than people. That is outrageous. The Center for Medicare and Medicaid Services even link reimbursements to patient surveys that ask whether your doctor did everything they could to help with your pain. Generational and cultural drivers are also at play. Back in the 1960s and 70s, there was a sizable drug abuse epidemic, and most of it was driven by boomer youth. Today, these same boomers have spent a lifetime dabbling in mind altering substances, are a major driver of today's plague. You know, that's very strange because, like I said, the age where they're dying of drug overdose and the suicide um, age range is exactly the same. So you know this stuff is altering their minds because they've been on it for so long, which tells you that your body really can't handle these different chemical compositions that are in these pills. It's unnatural. I don't know. I just, it just brings me back to the Bible where it says that, we use the herbs of the earth to heal ourselves. And we're not using that. People are running to their doctors and getting these manufactured unnatural pills to treat their pain. I really think there's something to that. But let's move on. Are a major driver of today's plague. Research shows that Americans are more likely than Europeans to believe that life is perfectible, making it all the more likely that a boomer might seek out substances to deal with the pains of aging. Experts are conflicted on the appropriate next step. Some say lawsuits against Big Pharma are the answer. I don't believe that. And number two, let me tell you something. That money that these states win from Big Pharma don't even reach the addicts at all. And I read that over the summer. Yet, even as the number of opioid prescriptions has fallen each year since 2012, the death rate from street drugs like heroin and fentanyl is rising faster than ever. Others maintain that the most useful tool against overdoses is the antidote naloxone, which dozens of states now offer without a prescription and law enforcement officials routinely carry. But you remember the newer fentanyl analogs don't even respond to the Narcan now. In the meantime, the opioid plague will continue to leave its mark on Americans of every age, babies born addicted, kids inundated, foster care, and that's a shame. But you know what? That same thing happened during crack epidemic. Our kids were pouring into foster care back then. addicts overdosing in public places, and grandparents who find themselves gaining custody of young children. Addiction is unique in that it affects often ripple outwards and linger for generations, leaving communities grasping to find a way out of an epidemic that shows no signs of letting up. Wow. Woo, ladies and gentlemen, tell me what you think. This article was very detailed. Please leave your comment and subscribe, and don't forget to hit on that notification bell. And if you can make a donation to my channel, please do. Peace, family.